So before we go anywhere, click the subscribe button below and also click the notification bell so that whenever we make an update, you get it, right? We want to amplify health conversations in Zimbabwe, and we want you to be on this journey with us. Thank you so much for believing in Health Times. Thank you so much for being here. We appreciate you so much. Hello and welcome to Health Times TV. Today we're just going to talk about the 6 major health threats that are likely to shape 2026. So this is according to an article that was done by Gavi. So it's Linda Gates. You can follow her on your social media platforms. She's the one who wrote this article for Gavi. So Gavi is actually the Vaccine Alliance. They also assist with the logistics and the likes for countries just like ours, like Zimbabwe and other countries. So this time around, they've actually come up with a list of 6 major health threats that could shape 2026. So I'm just going to go through them here. You are free to visit Gavi, the Gavi website, that is www.gavi.org for some of the articles. So number 1, conflict-associated outbreaks. So I think you can see that already in 2026. There's quite a lot of conflict that is already visible. There's a lot of wars that are being fought in almost each and every part of the world. There's a conflict that is happening that is actually going to have a negative effect on healthcare in 2026. So we can point the wars that are happening right now. There's the war in Ukraine. There's the war in Sudan in Africa. There's the DRC M23 rebel and the likes, which has been going on for a while. There's the Iran, US, Israel thing that is happening right now. So yeah, Pakistan bombed Afghanistan. So it's like we're in World War III already. So it's according to Gavi, by some measures, violence and disputes between and within states are approaching the highest levels since World War II. Conflict drives emergency and transmission of infectious disease by displacing populations, disrupting healthcare delivery, and breaking supply chains for food, clean water, and medicines. It can also accelerate the spread of antimicrobial resistance. So, talking about that, the Democratic Republic of Congo right now contributes over 60% of Africa's cholera cases at the moment. Why does it seem like reigning in cholera in the Democratic Republic of Congo is a bit of a Sisyphean task? It's because of the conflict. Sometimes healthcare workers cannot even access the affected areas just because there will be conflict there, and access to clean and safe water during these times can be quite a challenge. So yeah, the issue of conflict is serious. You look at Sudan as well. Sudan is quite actually also having some cholera recurrences here and there because of the conflict that is happening there. So conflict is not a good thing, and according to this article, conflict has reached the levels, or actually exceeded the levels of World War II right now. You look at the issue of antimicrobial resistance. So when Fleming during World War times, way back when he developed penicillin, it was cheered on like it was a breakthrough, but after some time they started realizing that no, something's happening here. We're trying to treat our wounded soldiers, we're trying to treat a number of people, but somehow they seem not to be responding to the medication. Why? It was because of antimicrobial resistance. People ending up taking antibiotics even without prescription, I would say, just to get over, or maybe due to overuse, AMR can actually become a thing. So what is issue number 2 that we're likely to face in 2026? Climate change and airborne arboviruses. This is a thing that is already happening. Climate change. You look at the flooding that is actually happening as a result of cyclones, right? You look at countries like Mozambique right now is battling a serious cholera outbreak that is induced mainly by the flooding that took place after the country was hit by some some heavy rains and flooding and a cyclone. Zambia is also coming. Zambia, Malawi, they are also recording these cholera as well. Then you look at the issue of arboviruses. You look at the likes of mosquitoes in Zimbabwe. We are now starting to record malaria in places that you never used to record malaria. Growing up would know that malaria is mainly, you can find it in those low-lying areas, in the likes of Binga, Gokwe, Wange, those high temperature, those hot places. That's where you would find malaria. But right now, we are actually recording malaria in places like Mashonaland in the east, the likes of Koromonzi, even Manicaland. The cases are going up. So it's quite alarming. Climate change. We are now seeing these arboviruses moving from their traditional habitats to new places that never used to record some of these pathogens and diseases. So yeah, we need to look at this seriously. There's also the issues of yellow fever, chikungunya, and dengue in some places. This is according to Ignacio Esteban, the senior manager in Gavi's policy team. So that's mainly due to the temperatures that are going up. Then we also look at global health funding cuts. Right now, this is actually a big issue right now. So you look at it started last year. Okay, I can say before 2025 already funds, especially from global partners, had already started dwindling. But as of last year, following the proclamation by the United States President Donald Trump, we actually witnessed that funding has been a challenge. A number of organizations that used to program and to work in communities have gone down. A number of commodities that used to be procured by these development partners are no longer being procured, or maybe they've gone, the quantities have gone down. So you look at in Zimbabwe right now, the recent the pull out from the MOU negotiations that were going on between Zimbabwe and the United States. You find that Zimbabwe pulled out, citing some irregularities, but the fund, the 350 something and above million, was supposed to go towards the issue of HIV, maternal health, a number of things. So now, for a country like Zimbabwe, I think, our government have got resources, we've got the minerals. They need to step up and actually fill in the gap that was left by the donors. Unless they go back to the negotiating table, something needs to happen, and it needs to happen very, very fast. And Africa as a region needs to come up with a sustainable domestic financing model for healthcare, like it's being pushed by the Africa CDC. Africa CDC is championing is championing this, to ensure that at least Africa, regains its sovereignty as far as healthcare is concerned, because we cannot continue relying on donors. One day or the other, they will leave. I think we saw that last year. Right now, a lot is happening. Some healthcare workers are not getting paid because they're on donors' payrolls. So it's quite an issue, right? Health misinformation. This since the COVID pandemic, we started experiencing quite a surge and a lot of misinformation with regards to healthcare. You start having theories flying around. Right now, we've got the lenacapavir that is being rolled out. Already, people are starting to package it as a vaccine, which is not. So there's need for health promotion to up their game across the region. There's need to invest in health promotion as a region, so that at least we cut down on the misinformation and inform the publics accordingly and correctly, right? Issue number 5, Marburg virus disease. Wow. Yeah, so the Marburg, well, according to Gavi, it is unlikely to cause the next global epidemic, but in 2026, it remains a growing regional threat in parts of Africa. So if you recall, in 2025, Ethiopia, which other country? Was it Tanzania? Ethiopia, Tanzania, and other countries reported this virus. So it's a hemorrhagic virus, and it's very fatal. And we pray that it doesn't become the next epidemic, because it's quite the fatality rate is actually very high. So yeah. According to Gavi here, it causes severe illness, marked high fever, muscle pain, gastrointestinal symptoms, and in some cases, internal and external bleeding. Case fatality rate often exceed 50%. That is way above, above half, particularly where diagnosis and supportive care are delayed. So Marburg. Then the last point, disease X. Well, I don't know what they're talking about here, but they're saying it's disease X. So when global health experts refer to disease X, they are not predicting a specific virus or death. The term describes the next unknown pathogen with the potential to spark a serious international epidemic or pandemic. While 2026 is not inherently more dangerous than other years, several assessments suggest that the world may be entering it less prepared than the immediate aftermath of COVID-19. So let's discuss. Where do you think the next global health pandemic is going to come from? There are articles, predictions that have been made that the next global health pandemic is going to come from bats. Bats, those creatures, they're troublesome. Yeah, some predicted that that's where the next global health pandemic is going to come from. But you can see that Marburg is one of the diseases that comes from those bats. So I don't know what the next global health pandemic is going to come from, but it's likely going to be a zoonotic disease. Just that's my thinking. You know why? Because more and more human and wildlife interaction is happening right now, be it especially here in Africa, due to the growing population and the need for land for industrialization, habitation. You find that humans are now encroaching places that used to be wildlife sanctuaries. Now we're getting in there, we're interacting with the environment that never used to harbor humans. So we're now getting zoonotic linked diseases that they're actually dangerous, and there's need to actually educate the publics to actually maybe not encroach into these habitats, try to find alternative places to construct, whether it's industrial sites or residential areas. We need to come up with a solution. The next virus could be, the next pandemic could be a flu bug, just like COVID-19. Who knows? Yeah, we learned a big lesson from 2020 to 2022. Well, the world was shut down, and this March we actually mark the 5th, was it the 5th? Yes, it's 5th anniversary after COVID-19 was reported, and we don't want to go back there. So I think, it's reported that COVID came from wildlife. We need to really be intentional about the way we interact with wildlife. Let the animals be in their places, we be in our places. That way we can minimize the risk of infections jumping from animals to humans. That's my thinking. Have a great day. Enjoy. My name is Michael from Health Times. Hope to meet again. We're going to be having more and more of these health discussions here on Health Times. I hope you like them.